You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says, no more dentures. With us, we have an expert on the topic, Dr. Gena Schultheis. Dr. Schultheis, welcome to the program.
Thank you, Randy.
It's Schultheis, right? There's a T in there.
Yeah.
Okay, good. Now, for people that don't know your practice, I mean, you are kind of known as the, as you say, like the Whole Foods of dentistry.
That is correct.
So who is the typical patient? Because you just don't do dental implants. I guess you do everything.
Right. We see everyone. Our typical patient's anywhere between 1 year and 100 years old. We are general dentists. We do have some specialists in our office for orthodontics and periodontics as well. But we basically perform dental cleanings on our patients. We will give them, fillings if they need it. We provide a natural treatment for migraines and headaches. We use lasers to help cure gum disease, and we can place veneers that are beautiful. We will even pull teeth. We don't like to. We all get a little sad, get out the tissues when we do, but in this day and age, there's nothing better than pulling infected, broken down teeth that make people sad, they're not good looking, and replacing them with dental implants, which are fantastic. We do all that stuff, we just do it a little differently. That's what sets us apart in the holistic manner.
So at the top of the show, when we say, you told me that you tell your patients you're like Whole Foods. Elaborate on that. What does that mean?
It means when you're coming in for dental cleanings, we're going to be using cleaning pastes that are made out of cold pressed plant oils, whether it's peppermint, wild orange, cinnamon. They all naturally have antibacterial properties, and we use coconut oils and minerals that naturally strengthen teeth and keep them whiter and brighter, so that those patients are the ones that want to keep what they have going on. They don't want to hear me talk about things like implants. They don't want to know that we do extractions and gum surgery. They don't want to think about any of that. So that's what we do for our patients that are looking to keep their teeth for a lifetime. And then when it comes to restoring teeth, the holistic aspect is that we're using all porcelain fillings, and we're using biocompatible BPA-free resins for fillings, and that we're using implants that are also metal-free.
So you even offer non-titanium metal implants.
Yep.
Is that right?
We do. I have one here somewhere.
Okay. That's it?
Yep, that's it.
So what is it? What's it made of? It's like a ceramic of some sort?
Yeah, it's zirconium, and again, not to get too nerdy on the periodical table and what exactly a metal is and what a metal isn't, but it's not found on the periodic table with metals that can cause allergic reactions in the body. So the body takes it in, it's more biocompatible, and they're probably going to be starting to use it this isn't the first screw you're going to see in your body. Knees give up, hips give up. This is where things are going in the future.
Okay, good. So at the top of the show, we said no more dentures. Do you believe that?
Yes.
I mean, is that the future?
It is. I mean, I can't imagine. I've listened to patients complain end on end about how they hate these wads of plastic put in their mouth, moving around. I can't see why anyone would want them. The only reason people still have them is that was the only option that they had when they lost their teeth.
So the future, what? Dentures will be attached to dental implants?
Right, they will be attached to dental implants. Any of my patients coming in now that know their teeth are going and their teeth are bad, I mean, they know from hearing the people complain for the last 30 years that they absolutely don't want dentures. So they want to know how they can have teeth again. And this is your third set of teeth. We're just giving it to you instead of you growing it, for now.
So are you saying that most denture wearers are just not happy with their denture? Because I know a couple of denture wearers, at least, no complaints. They seem to be happy with their denture.
Well, they're not complaining to you because they're trying to hide what they hate about their dentures.
Okay.
I mean, they're happy that there's teeth in their mouth, so they don't even want other people to know that they don't have teeth. So why would they tell you?
Yeah.
So they try to keep them in. They try to pick just foods that they can put a little piece in the back and attempt to chew and swallow without things running out of their mouth. They try to just nicely slip away to the bathroom afterwards to clean up after the dentures and the food that's underneath them, flush them out so their breath doesn't stink. So they're not going to complain to you. They're purposely trying to hide it. I've had patients that have told me they don't even take their dentures out at night. They have ulcers, they have infection, their gums are hurt, but there's no way they want to even talk to friends and spouses, and especially people on the teeth, and let people know that actually if I took these out, this is what I would look like. They don't want people to know that. But they are unhappy with what they can and can't eat. They come to me talking about it, but maybe not to you. In
Annapolis, are there a lot of denture wearers? Like approximate, how many? like upper lower denture?
Approximately probably half the population, number of people that live in a state like Rhode Island. DC is a dense area, and we have a practice both in Calvert County and Anne Arundel County, and there's probably 50,000 plus
Really?
wearing just dentures. And then there's another 50,000 people that are told that they're going to need dentures, and they're holding on to 4 teeth, 5 teeth. They have these partial dentures hanging off of other teeth. They're gluing teeth in. People come in all the time, they open their mouth and they're like, here, I want you to look. I told I'm going to lose. They're like, don't touch anything. Because they literally, if I touch anything, all the teeth are going to fall out of their
Really?
mouth. The pieces of the teeth, the composite fillings, everything that's holding it together. So there's a lot of, a whole nother segment.
And you can help those people.
Absolutely. You can see what's savable and what we can maybe use your own. Maybe you don't need a ton of implants. Maybe you only need a few. And maybe we just need to give the rest of your teeth an upgrade or a facelift, tooth lift.
Now, if there's that many denture wearers, you say maybe 50,000 people, why aren't they all doing it? Why aren't they all coming in to get their teeth, either a fixed set of teeth that don't come in and out, or something that snaps in and snaps out? What's your take on that?
Well, I think there's a few reasons. Randy, the thing I see most often is that a lot of people start to tell me stories. They come in and they're telling me stories about how many years they'd spent doing all of this dental work. And it sounds horrific, trust me. You and I have only gone to the dentist since they were using local anesthetic, since they maybe put some, aromatherapy and candles in the office. Like, we weren't going there when these people tell me they had teeth pulled without anesthetic. They tell me they have 2, 3 root canals. I don't even know why you would do that many root canals. One's enough. So these people are so glad to have all the teeth out of their mouth that they're just not jumping to come back into the dental chair. So
they don't want to go to the dentist.
Right. They just see it as another group of procedures that they could do, and they may possibly even fail them. Some of them were told, your bones stink, your gums are unhealthy, you don't have bone for implants. And so they may have gotten that information, a decade ago, but it's not true. So they don't know their options. They've had dentures and they simply just have no idea there's another option out there. Many of them think they're even too old, but I know that's not the case.
How old can you be?
You can be 90 to 100 years old. You can be that old. My actual first implant patients when I got out of the military were all 70 and 80-year-olds. And what I was doing then, and it shows too, another fear they have is pain. But let me just talk about this one individual. It does, but like I said, the first military patient I had out of the military, he actually had a bridge that failed, so a whole arch of teeth, and he immediately knew his friends are old. He's 80. They all have dentures. He knew he was not interested. So he asked, can I have implants? I said, absolutely. We took the teeth out. We put the implants in, and he gets a bridge that is either screwed in or cemented to those teeth. In his case, it was cemented. And he goes home. And me being in the military and only placing them on younger individuals to that point, I'm calling him that night.
You're worried a little bit.
Oh, yeah. I'm like, this guy's 80-some years old, and he just had an entire arch, not just one single tooth, entire arch of teeth replaced. I call. He got the procedure done in the morning. I call his wife, and I'm just like, oh, how's Joe doing, And she's like, oh, that's right. Yeah, he went to the dentist this morning. I was like, yeah, he didn't come home like talking about it, And she's like, oh, well, he came home. He went out to walk the dog. She's like, he came in for lunch, and right, we ate sandwiches. So she's like, I assume he wasn't in much pain or anything. And she's like, right now he's out mowing the lawn. Do you want me to go get him? I was like, no, I guess not. I'm like, just tell him I called, and if he has any problems, give us a ring at the office. So I knew right away with the first cases of dentures that I did on.
And that was like 15 years ago when you first started.
Right, that was 15 years ago on patients that were 80.
Is that common?
Right, now I know. I don't even expect. I have had patients that have, they have strokes where they're in wheelchairs. They just had a stroke 2-3 weeks ago, and he's coming to me for his teeth right away because a lot of them broke when he had strokes and he fell and things like that. And he's like, nope, this is right. He was dating online, and this stroke ruined his dating life. He had women flying in. And so immediately after a stroke, he was in to see me, and I don't even now have to, I called him to check up on with him, but I'm not expecting, like I was 15 years ago, for the patient to tell me, I had the same misconceptions they did. I thought that an 80-year-old was going to be sore from this procedure. And
you mentioned, though, like 90-year-olds are doing this. Why would a 90-year-old want to do it or go through that at that point?
Because they want to enjoy life. Who doesn't? Up until this point, they weren't able to go with their grandkids to the boardwalk and get their caramel corn and popcorn and all of that stuff that they did as a kid growing up. They're going to graduation parties. There's a ton of food. They're at weddings. They don't want to be unable to eat and enjoy what everyone else is doing. They don't want to not be able to be in photographs or not smiling in photographs and looking like the grumpy grandma who must not even like, the son-in-law. They want to be out there enjoying life like the rest of us.
So you can eat, you can chew, just like regular teeth.
You can eat, you can chew, you can do yoga. I have some patients that actually went in trapezing groups are becoming bigger now. The flying trapeze, you can't have flying dentures coming out. They actually join it. Not my 90-year-old patient though, but these are patients in their 40s or 50s that are looking at some different hobbies, and they couldn't do things that were good for their body, like yoga and golfing and trapezing. I don't even know what kind of verb that is, but they wouldn't be able to do those activities. You know,
so no more dentures.
No, you want something that's there. You don't want to smile and have your smile.
So what are the options for denture? Okay, so a denture wear goes in, you're on the consult. How many implants? What are their options?
There's multiple options out there. The easiest option is just to get something as simple as 2 to 4 implants and have your denture click into it and actually hold.
It's like a snap-on?
Snap into your jaw. So it's not
floating around. Do you call it that, like a snap-on?
Yep, you can call it a snap-in denture, a click-on denture. We just call it implant retained denture. It's being retained there. And right, you can say bye to the glue, bye to not being able to eat apples and corn, bye to soft foods, hello to nuts and you know, vegetables. So they immediately get to function with very, 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 very little discomfort, which is what they're fearful of. Very little, sometimes people think dental implants aren't affordable. Well, yeah, if you're replacing 28 or 32 teeth, they might not be that affordable. But to get 2 dental implants is extremely affordable.
So 2 implants, snap in, snap out. That's the first
level.
That's the first
or 4.
option.
Yeah.
What's the next level up?
The next level is sometimes people want a little more stability. They still want to be able to snap their denture in, but they only want to take on 4 or 6 implants. And some people, they'll get what people really want when they really want no more dentures, is they want to throw something in their drawer and have teeth again. And so screwed in or cement retained teeth requires about 4 to 6 implants depending on the arch.
So a fixed set of teeth that don't come in and out.
Right. That's kind of people's, you know, that's the prize. That's what these denture wearers really want.
Is that possible for everybody? I mean, could your gums, what if people have bad gums? That's why they lost their teeth in the first place.
Right.
Can they get this?
Many people can. The reason people thought it wasn't possible for everyone in the past is because they heard that they didn't have bone. They heard there was all this gum disease. They had bad gums. But once the teeth are gone and once the body is healthy, and especially once you get implants retained into your mouth, you become healthier, you eat healthier, that disease you're eradicating it. It was a disease of the bad teeth. So now with implants that are biocompatible to your body, you're actually preserving the bone. You're preserving healthy gum tissue. You're igniting that bone. You're stimulating it. It's ready. Your bone was meant to have teeth. It wasn't meant. You know, no one was meant to be a dentulous. So yeah, everyone's a candidate. And now we can even too, people were getting shuttled around from doctor to doctor to doctor to doctor, one person to extract a tooth, one person to place the bone. Oh, wait 6 months. Oh, here's an implant, but you can't use it. Wait another 9 months. They still didn't have teeth. I would see them a year later and I'm like, where's your teeth? Like, what are we going on here? And now, whether the patient comes to me with god-awful teeth that they're ready to get rid of, and we simply pull the teeth and put the implant in that day after disinfecting the site, or whether the patient comes in with no teeth at all and no bone, we simply place the bone and the implant together. So the number of surgeries and the days of driving around to multiple locations to try to get bone here and a tooth here and a tooth pulled here are gone.
So you do, okay, because how it is, I've done some research, how it's normally done is you go to one person, maybe a specialist that does the surgical part of it. Then you go somewhere else and they put the tooth on top. Is that correct? And maybe somewhere else for the imaging. You do it all right there.
Right.
Is that right?
And the way that you're talking about, that was correct 15 years ago.
But it's still happening that way.
It is. Again, not everyone, you know, is right. I just cannot explain to you why it's happening. I really don't know.
Okay.
Because the implants, I guess in the past, you know, right, you needed all this bone. Implants were about 16 millimeters long. Like my first implant I placed
like you
for that
showed
long.
me that implant right there.
So how much bone do you need? And this is a molar implant. Your very second to last tooth, the biggest tooth. This is a molar implant.
It's nothing.
That's right. So that's how much bone I need, and that's a molar. I don't need that on these little teeth up front. So you're looking at half the size. That's not that much bone. It's not like I got to take, you know, half your femur off and graft your jaw, you know, like it's very, very minimal. And there's biocompatible bones that are just the natural minerals found in bone that I can just place around the implant to hold onto it, build it up so that a small implant can take in your arch. And again, you don't have to be worried about having second surgical sites and grafting parts of the jaw, the roof of the mouth, like.
Is this the happiest group of patients?
Yeah.
People that had no teeth and now you give them teeth back?
They're
Permanent teeth?
They are. I think they're number one on the happy list for our group of patients. And then the second happy
They give you
is the
hugs?
people. They do. We hugs. We get pictures. We get pictures from the weddings. We get pictures from the graduations. We sometimes get pictures of the girlfriends and boyfriends that are coming to visit, the ones that they're bringing to our office because they need help with their teeth. Yeah, we get pictures of it all.
Now, people are afraid
and
of the
gifts.
dentist.
We get a lot of gifts.
Now, people are afraid of the dentist, right?
That's
But what about you? I mean, are they afraid of you? I can't imagine they're afraid of you.
No, that's what they always say. They're like, and they're always very embarrassed about it. They always, cause first state, they're like, I'm really self-conscious about this and I'm very embarrassed about this, but I have been scared of the dentist since I was about 15. I had a terrible childhood of teeth, grew up with, maybe I didn't take care of my teeth, maybe my family didn't take care of teeth, maybe I was on medications that ruined my teeth. All of that stuff had made them undergo experiences at the dental office that were not pleasant.
We are short on time. So you brought photos, and I know you wanted to show those. So what are we looking at?
Well, let me show you, since my passion is this new little white implant, because who doesn't like things that are white and
people
pretty?
need to know we're talking about no more dentures, getting a fixed set of teeth in just one day, permanent set of teeth with dental implants. And we're also talking about non-metal dental implants, right?
Right, so I'll show you the non-metal case
Okay.
first, just because it's exciting and it's new, and it's where things are going. So this is a patient who had, you can see from the back, she had lots of old crowns with those gray lines, at the gum line, and she had teeth that a lot of these crowns are actually, even though she didn't have denture, she's using fixodent. She's using denture glue to hold her crowns on broken posts underneath the teeth.
So
And
these teeth had to go. Like she was headed for a denture?
some of them, some are gonna, some that are in good shape, she's gonna keep. These ones that are just glued onto stubs, yep, we took out the tooth, and that same day we put a little ceramic post right into where we extracted the tooth, no additional surgery, and we could get her a tooth that day as well, temporarily, so that she never was without teeth, because that's a big fear. Sometimes people think the reason they don't want to do all this is because at least they're gluing their teeth on. That's at their discretion. They have the ability. It's in their control. If you let a dentist take away your teeth, like what happens if they can't give you something immediately? But we can. We will never let our patients without teeth. That's why I tell them that, because that is a big fear. So we gave her something right away. She's moving and grooving. She's enjoying life. She's smiling. She was beautiful before. I mean, this was a drop-dead gorgeous patient, but her teeth were just not showing the beauty because it was old dentistry. And then I'll show you some other patients. This is an older patient, grandma, but grandmas want good teeth too. And they don't want to be taking teeth in and out. And what happens is, like in her story, people tell me these stories. I had one grandma, this is a denture patient, that her grandson was, always asking, Grandma, where's your tooths? Where's your tooths? And why are your tooths gray? Why are your tooths gray? And she just was so self-conscious. Like even the 5-year-old notices that where my teeth, my teeth are. And when she got her full arch of teeth, and she got those just clicked into her jaw, no major thing here. She went home that day, and her 5-year-old grandson actually said, "Oh, Grandma," he goes, "You look beautiful." He didn't even say your teeth are there. He just said, "You look beautiful." And those 3 words just turned her life around, because she's like, right. I do. I feel beautiful now. I feel like I have energy. And she said that day they were off and running, and she never could, again, go out with him to the boardwalk and eat and have fun.
Well, they look natural.
Yeah, they look super natural.
So that's like a snapped-in denture?
Right, you just snap in the entire denture.
So this is cosmetic. I mean, because I always feel like I could spot a denture.
Right.
So you make these look real.
You can make them look real. And they feel real. That's the kicker, too, is not only do they look real, they feel real. They can eat with them. Some dentures look nice. I got some patients, they look nice. If they don't move, like I said, they don't want me to touch their teeth. They can't eat. They look nice, but they can't kiss because their denture will fall out in their spouse's mouth.
You say that there are married couples that maybe one of them doesn't know the other one has a denture.
Right. I have people that say they wear them all night long. All night long. I mean, then they know they technically have a denture, but they haven't seen the person without teeth.
So could they secretly come in, like, get this done, and pull it off without even letting them know they just had something done?
They probably could, because I don't ever really see, like I said, most of our patients taking
over-the-counter
Tylenol.
They're not without teeth.
Nope, they do not have to be without teeth. And we can even retrofit the denture, but get rid of all the plastic. Again, for some individuals, they like the way they look. They're not that old.
What do you mean retrofit?
We can basically take the denture they have. And a lot of people want brand new dentures, because if they've had one for 30 years, it's stained. They would have never picked that shade of teeth. or they don't like the way the shape of the teeth are not long, they're not beautiful. But some people just were misinformed 5-10 years ago. And so their dentures from 5 years ago may look nice, but they didn't realize they weren't going to be able to function or chew or smile or exercise, kiss. They weren't be able to, they didn't know that that's what denture wearers were going to experience. So once they experience all that stuff, they don't hate the way they look. We simply just take off all the extra plastic that's holding them in the roof of the mouth, or we take the lower one and we just make holes for the snaps. I tell people it's just like a snap on your jacket. And we put the implants in, and within 5 minutes, we can just snap their own denture right back in to the implants that we placed within an hour.
How soon can they eat?
Minutes. They can eat right away. We tell them to keep to softer foods, be careful of biting your cheek. Sometimes you're still numb. But we tell them to, start with softer foods at first. But most patients, as soon as they feel it, they're not sore in 7 days. They're calling me, telling me about, like I had one patient that would always come in with her Granny Smith apple, like just to show me, like, I'm like, do you really like Granny Smith apples that much? But that was her, that was her thing.
So you can eat an apple?
Every time she came in
with
for appointment.
With your front teeth, can you do it? If you have a fixed set of teeth, you could do it?
Yes, and she did, so she just got Granny Smith apple every time she came in the office. So usually they can start to eat then the meats that they couldn't eat before, the vegetables, the nuts, all of that stuff that they were missing out on, and the stuff that is healthy, that then gives them, now they have this smile that's exuding life. Now they're actually, nutritionally are so much better off. They're able to get off medications because they're now eating healthy foods, their blood pressure's lowering. Also, they too, like, this is interesting research for you.
All right.
How important a smile is, because I'm probably just think
well,
I'm
you're
a dentist. Right,
yeah.
You're like, this is so
You probably think it's very important.
It's very important, but studies show that when you smile, these things happen. It's a drug, it's a miracle, it's magic. Smiles decrease your blood pressure, they decrease your heart rate, they actually release endorphins, all the same stuff that are in antidepressant medications and anti-anxiety medications, which a lot of older patients with these dentures, they're on because they are anxious. Life isn't, it's not great. They have these teeth they hate, they can't eat, they can't chew, their social life is struggling because of it. So you start to smile and these endorphins are released. You feel good. They show that they're the same endorphins that cause less stress and help you live
You told me on
longer.
the phone, when you smile, the world smiles back at you.
It does.
Elaborate on that one.
Yeah, well, I have a few smile quotes I always love, and I kind of post them in the office, sometimes in the bathroom, all over the place. But you do. When you smile, people smile back at you. People always think that, sometimes it's the joy in life that then makes you smile, and that's the case. If something great happens to you, you're told you win the lottery, you're going to smile. Yeah. You're off and going. Someone bought you a boat, awesome. You're going to smile. But if you're having a bad day and you smile, sometimes it's that smile that then brings the joy into your life. You smile at someone, struggling on the street and you help them. You smile at a child and they giggle back. You're automatically getting joy from all these interactions. So when patients start smiling at work, they start to get promoted. They start smiling when they go out with their friends and eating the food and going to social engagements instead of after bowling, just heading home because I can't eat, I'm scared of my teeth out. They start to meet new people. They start to date new people. They start to get closer with their spouse.
Do you hear these stories from patients?
Time and time
like,
again.
They had no teeth, you give them teeth back with dental implants, and then they tell you about all this stuff.
They do? They get life back. They get life back. And people don't think of it this way, but you're taking a body part. If I was an amputee and I took my leg and I was in a wheelchair and no one ever told me that I could get a surgery and I could get my leg back and I could do things I love again, like walk and run and chase my children, that would be an upsetting life. These people don't
know their options.
Right. They've had part of their body taken away from them, their teeth, something that you and I use for enjoyment, to eat, chew, smile, make friends, show affection every day. And these people had that taken away
So is that why you're doing this show? Is that why you agreed to do this?
It is. I know. I want to spread the message because it floors me. It floors me that people can't just naturally enjoy life, that when people smile, they get prejudged on the state of their teeth and the state of their smile. Individuals that the smile, is not bright, it is not white, the teeth are broken, there's a bunch of missing teeth, they look jack-o'-lanternish. These people think they're not intelligent. They think they're not warm and compassionate. They're not loving.
Just because of their teeth.
Just because of their teeth. And people think they're not intelligent. Like insane amounts of things. But I have these patients that are prominent people.
Let me see that one.
Yeah,
we have time for one more.
This is an individual who, you're working at the courthouse.
Wow.
You're working in front of people. You have a high-powered job, but yet on first appearance, people don't think you're the person you are. You know, people don't think that you're able to help them, that you are as, like I said, intelligent
But
as
most
you
of
are.
these people just walk around Annapolis, like you say, that they don't smile. They look
Right.
grumpy or
Right.
miserable or depressed.
Exactly.
So come in,
and
get evaluated.
Right, and then you
Is that
can
what-
feel the way, you know, you portray the way that you feel inside, you then can feel that way outside. And the more that people start to do that, the happier and happier it makes them. I mean, happiness, let's face it, that's a driving, you know, a driving thing of how we all want to feel, is to be happy. And people that can't smile, that are embarrassed, that feel that other people are looking at them or staring at them, thinking that, like, ooh, they don't take care of themselves. You know, this guy flosses every day. He does. But his teeth have been broken due to the fact of, you know, wearing his teeth down.
So in one
He's broken
afternoon,
them.
his whole life has changed.
Right.
Good,
Absolutely.
good. Final message, we're out of time. Okay, so people that are headed toward dentures, you want those people to
Yeah.
come in, or the people that are already wearing dentures and you're saying with just two implants, let me, as a recap, can snap in, snap out, or maybe 4 or 6 to get them a fixed set of teeth that don't come in and out. What do you say to the people that are watching this and they're still skeptical?
They just need to find out what options there are. Like you said, there's everything. There's the 2 implants, just 2, 1, 2. That's it. That can keep their teeth fixed. There's the individuals that, right, they are scared to death. That was last week for me. Every patient that came in, they've had dental work done in other countries. They've had dental work done here. They've now spent a year seeing dentists, just having filling material just glued to their teeth. They're scared to lose their teeth because they're scared to have dentures. So those people need to come and find out, well, how can you still get implants but never be without teeth? No one will, like,
And you can do
have
that.
them. You can do this. And then there's the people that have their own teeth, but they just don't like the way they look. Well, and there's options for that. There's still bridge work. There's still beautiful porcelain crowns. There's all porcelain restorations, all porcelain
And
implants.
you're the
all
holistic,
porcelain
I'm calling you
crowns.
holistic, but you're doing everything with natural materials. I mean, you're also known as the holistic or green or eco, what do you call yourself?
Right, a little of everything. Some people call us integrative dentists, holistic dentists, biological dentists. I didn't know there were so many terms for, like I said, what we do. We just consider ourselves just the natural dentist.
Natural
yes,
dentist.
Trying to keep it natural. Like you said, no one wants to know that anyone has fake teeth. No one wants to have unnatural healing. No one wants to be on antibiotics and drugs and things. Like, no, we just want to use natural products to help people that want to keep their teeth and avoid all of this. We want those people so that we can help them avoid it, because it's possible, but that takes work too. And then we want all the people that are sitting at home not being able to get healthy because their teeth are constantly taking a toll on their overall health. We want those people to come out and come in so they can get well in the mouth, well in the body.
Okay, good. And for the denture wearers, free consultation?
Sure,
They could go and meet
Bring
with you.
them in.
And
We'll talk about them.
We are out of time. I want to thank you so
Okay.
much for coming on the show. Great stuff. Great info. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.